Professor. My name is Divya Sachdeva and my student ID is 1189572440. And today I'm going to perform head to toe examination. This is the 360-degree view of my room. So my hand washing is done and the privacy is maintained. Hi, my name is Divya. I'm your student nurse for the day. What is your name?
Sheetala.
Okay, and what's your date of birth?
It's 1994.
Okay, can I see your ID card so that I can cross check? Okay, Sheetal, so here I'm gonna do your head to toe examination that is prescribed by the doctor. Are you okay with it?
Okay.
Okay, so let's start with the neurological examination. In this, can you tell me what day is today?
It's Friday.
Okay, where are we?
At home.
Okay, and who amount to are you?
You are student nurse.
Okay, so next I'm gonna check your parla, and in this, before that, I can say that the patient is totally oriented to time, place, and person. For this, Sheetal, can you please focus on any distant object at the wall? I'm gonna flash light on the right eye and afterwards on the left eye to check the pupillary response. And now I'm gonna check the consensual response in this. I'll flash light on the right eye and check the left pupil, and afterwards on the left eye and check the right pupil. So afterwards, Sheetal, can you focus on the tip of the pen?
Yeah.
So as I'm moving it closer to you, now just follow the directions, don't move your neck. From this I can say that the pupils are equally round and reactive to light and accommodation, and they are bilaterally accommodated. Afterwards I can, so next is I can check your facial drooping. For this, Sheetal, can you smile? Okay, raise your eyebrows. Just close your eyes. So I can see that there is no facial drooping. The next is for the speech. I can check for the slurred speech. Sheetal, can you repeat three things? Dynamite, moonlight, and flower.
Dynamite, moonlight, flower.
Okay, there is no signs of slurred speech. Next is pronation drift. For that, can you stand up for me? Hands up, palm side up. Count 1, 2, 5. Eyes closed.
2, 3, 4, 5.
Okay, sit down. From this, I can see that there is no pronation drift. So next is, now I'm gonna move to the respiratory assessment. In this, from the inspection, I can see that there is no scars, any bruises, any marks on the chest, and the patient is breathing normally, regularly, no labored breathing as well as no flaring. Afterwards, I'm gonna auscultate on the interior as well as the posterior chest wall. On interior side, there are 10 landmarks, and the posterior one, there are 12. But for now, I'm only gonna assess 6 at the front and 8 at the back. Sheetal, just deep breathe during the whole process. Stay calm. Can you turn for me? Afterwards, I'm gonna assess the symmetry of the chest wall. Can you deep breathe for me?
Yeah.
Okay, and just say 99 for the tactile parameters. Say 99.
99, 99.
Okay, from the inspection and the other things, I can say that the chest wall is symmetrical. There is no barrel chest or any pigeon chest. The lungs are clearly bilaterally. There is no adventitious lung sounds like wheezing, crackles, or any rails. And the tactile parameters or the vibrations are normally all over the chest wall. There is no increase or decrease in the vibrations. So next I'm gonna move on to the cardio assessment. For this, I'm gonna check for the 4 valves. The first is the aortic valve. Now I'm gonna put the landmark just below the clavicle is the first intercostal space, and next is the second intercostal space. The aortic valve is in the second intercostal space at the right sternal border, and the pulmonic valve is in the second intercostal space at the left sternal border. The Erb's point is in the third intercostal space at the left sternal border, and the tricuspid valve is in the 4th to 5th intercostal space at the left sternal border, and the mitral valve, where I can locate the apical pulse, is in the 5th intercostal space at the mid-clavicular line. Here I'm gonna check the apical pulse for 30 seconds. So the apical pulse comes out to be 40 multiplied by 2, it comes out to be 80. So the auscultation was totally fine. I heard S1, S2 sounds, which is the lub-dub, normal sounds. I heard no murmurs, brute or any S3 or abnormal S4 sounds. So let's move on to the abdominal assessment. For this, Sheetal, can you please lie down for me? On the inspection, I can see that there are no scars, marks or any bruises, burns, and the contour of the abdomen is flat. There is no bowel distension or any other abnormal reading present. After this, I'm gonna auscultate the lungs, bowel sound. For this, I'm gonna start with the right lower quadrant just below the navel and move in the clockwise fashion. After auscultation, I can say that the bowel sounds are present in all the quadrants. It's no more active. There is no increase or decrease in any bowel sounds. Now I'm gonna palpate. I'm trying to palpate deeply. It's deep palpation, starting again from the right lower quadrant and moving clockwise. So there are no hernias, no tenderness, no pain. Sheetal, did you feel any pain at any point? No. So she did feel any pain at any point. No pain, no tenderness, no hernias. And now next I'm gonna move on to the integumentary assessment. For this, I'm gonna see for any signs of scars, marks, bruises, any cyanosis, pallor. There's no signs of any scars, marks and bruises. So now I'm gonna check the temperature. I'm checking it bilaterally, both arms, both feet. So the body is fully warm, no cold to touch. Now I'm gonna check the capillary refill. For this, can you please give me your nails? So the nails are pink. Let me pinch your nail for capillary refill. The blood is moving back within 1 to 2 seconds. So the capillary refill is normal. Now I'm gonna check the skin turgor. I'm pinching both the arms and it's moving back immediately. So the turgor is normal. There is no sign of dehydration. Patient is fully hydrated. Afterwards, I'm going to check for pressure ulcers. I'm going to check the bony prominences, the ankles, the feet. Yes, there is no skin disintegration. The skin is totally intact. Afterwards, I'm going to go to see the musculoskeletal assessment. For this, Sheetal, can you move your hands towards your body? So, against your body. Okay. So, now move it back. I'm trying to pull it, so you have to make a resistance. Okay, so the resistance is 5 on 5, that is the muscle strength is 5 on 5. Now let's do with the feet. Raise your leg, just try to resist my hand. Other one. Okay, can you bend your knee? One knee, the other one. So here I'm gonna tell you that the resistance and the muscle strength is 5 on 5 on both the feet as well as both the arms. Now I'm going to check with the pulses. So first I'm going to go do the carotid pulse. For this, the carotid pulse is next to the trachea along the anterior aspect of the sternocleidomastoid muscle. Other side again. So the carotid pulse is positive, +2, strength is +2, it is regular and palpable on both the sides. Now I'm going to check the posterior tibial pulse. It's just distal to the medial malleolus. And I'm going to check on both the sides. It's palpable, +2 and regular. And now I'm going to check the dorsal pedis pulse, which is at the highest border of the metatarsal bone, just lateral to it, on both the sides. So from this I can say that all the pulses are palpable, +2 strength, regular, and there is no deformity in any part of the musculoskeletal system or in pulses. So I'm done with my musculoskeletal and my head to toe examination. This is my 360-degree view of the room. Thank you so much, Professor.